Throat cancer. Hi. Throat cancer, a serious medical condition that occurs when malignant cells grow in tissues of the throat, including the pharynx, larynx, and tonsils. This is a complex disease affected by many different factors, causing many difficulties in research as well as in diagnosis and treatment. Symptoms of throat cancer. Symptoms of throat cancer can vary depending on the location and stage of the cancer. Common signs include persistent sore throat, hoarseness or change in voice quality, difficulty swallowing, earache. There is a lump or swelling in the neck or throat area, unexplained weight loss, and persistent cough or coughing up blood. Causes and risk factors of throat cancer. The development of throat cancer is often related to several factors, such as 1. Use of tobacco and alcohol. Long-term tobacco use and excessive alcohol consumption significantly increase the risk of throat cancer. Toxic chemicals in cigarettes and alcohol can damage the cells lining the throat, leading to cancer development. 2. HPV papillomavirus. Some strains of HPV, a sexually transmitted disease, are associated with an increased risk of throat cancer, which is more common in young people. 3. Environmental factors. Prolonged exposure to environmental pollutants and irritants, such as asbestos and some chemicals, may increase the likelihood of developing throat cancer. And 4. Genetic predisposition. Although less common, a family history of throat cancer or other head and neck cancers can also predispose a family member to the disease. Diagnosis of throat cancer. Early detection of throat cancer is important for effective treatment. 1. Medical history and physical examination. Doctors will review the patient's medical history and conduct a thorough physical examination, paying attention to any signs or symptoms of throat cancer. 2. Check the image. Imaging studies such as CT scans, MRIs, and PET scans may be used to visualize the throat and identify any abnormalities. And 3. Biopsy. A tissue sample may be taken from the suspected area of the throat and examined under a microscope to confirm the presence of cancer cells. Throat cancer treatment options. Throat cancer treatment depends on many different factors, including stage, tumor location, and the patient's overall health. Common treatments include 1. Surgery. Surgical removal of cancerous tissue may be performed for localized tumors or as part of a comprehensive treatment plan. 2. Radiation therapy. High-energy radiation beams target cancer cells to kill them and prevent further growth. 3. Chemotherapy. Powerful drugs are given orally or intravenously to kill cancer cells or inhibit their growth. Chemotherapy is often used in combination with other treatments. 4. Targeted therapy. Drugs that specifically target cancer cells can be used while minimizing damage to healthy tissues. And 5. Immunotherapy. Immunotherapy drugs help boost the body's immune response to target and eliminate cancer cells. Prognosis and prevention of throat cancer. The prognosis for throat cancer varies depending on factors such as the stage of the disease, overall health, and response to treatment. Early detection and timely intervention significantly improve survival rates and quality of life. Preventive measures to reduce the risk of developing throat cancer include 1. Avoid smoking and drinking too much alcohol. 2. Practice safe sex to reduce the risk of HPV infection. 3. Adopt a healthy diet rich in fruits and vegetables. And 4. Regular dental checkups and oral health checks. So, throat cancer poses significant challenges for both patients, science, and the medical industry in general. To prevent throat cancer well, you should understand the risk factors for throat cancer mentioned above, and see your doctor regularly, especially when there are suspicious signs of throat cancer. Implement throat cancer prevention strategies, including avoiding smoking and drinking too much alcohol, practicing safe sex, and maintaining a healthy lifestyle. If you are unlucky enough to have throat cancer, you need support from healthcare professionals and your family. Patiently follow your treatment plan and regularly update information about your condition with your treating doctor. Prioritize self-care. Take care of your physical and mental health through proper nutrition, exercise, and stress management techniques. And staying positive, taking things one step at a time, and celebrating each small victory on a long journey prevents the progression of the disease. Wish you health. Thank you, goodbye, and see you again.